Well, greetings, Matthew Sue Medical Group patients. My name is Adam Robinson. I'm a physician here. And today I'd like to talk with you about influenza vaccines. It is the influenza virus season that is upon us, and we now have our vaccines available to administer. And so I thought it would be a good opportunity to share our thoughts and considerations regarding this year's influenza vaccine. I recognize that this is a very complicated topic, and everyone needs to make their own decision about what they would like to do regarding the influenza vaccine. And hopefully this information will help you do that, making an informed decision about what to do regarding the influenza vaccine. I have a list of 10 items to discuss today, and it's a top 10 most commonly asked questions about the influenza vaccine. So let's get started. Number one, what is it? The influenza vaccine that we have at our office that we administer to patients is an inactivated vaccine. That means it's not live. It doesn't have real virus in it. So you cannot actually get the virus from the vaccine because the virus doesn't live in there. It's not alive. It's inactivated. It is a synthesized particles that represent particles that are on the virus itself called hemagglutinin, and we copy those, we give those through the vaccine. Your immune system responds to that and makes an antibody to attack that virus when it recognizes that little molecule on the surface. So these are viral neutralizing antibodies that your body creates when you receive the vaccine, and this vaccine contains particles for 4 different strains of influenza virus. So it's called a quadrivalent vaccine. That means it's targeting 4 different strains. We know that influenza as a virus is ever changing, and it rapidly evolves, rapidly mutates, and so it looks different year after year, which is why sometimes we don't have a perfect match with our vaccine to what virus is in the community. And we recognize that, especially because we're using last year's information to develop this vaccine. It starts about 6 months before we have the vaccine available that the scientists are looking into their viruses that are circulating in the community. And then they try to guess, they try to predict what viruses will be circulating the next season. And then 6 months later, we have the vaccine. So sometimes there's a perfect match. The 4 strains that we vaccinate against are the 4 strains in the community. Sometimes there's a mismatch. But our vaccine is inactivated, and it's a quadrivalent vaccine creating viral neutralizing antibodies to fight against the virus if you encounter it in the community. Who is it for? Who gets the flu vaccine? Well, the short answer is anybody can get the flu vaccine as long as you are 6 months of age and older. But there are a few individuals that we consider a high priority to vaccinate against. Those individuals would include vulnerable individuals who would be susceptible to a severe illness if they were to get the influenza virus. Also would include healthcare workers, because healthcare workers are encountering this virus every day during the flu season. And then also close contacts of those who are healthcare workers and those who would be considered vulnerable. So who are these vulnerable people? Well, they represent extremes of age. So those that are younger than 2 or older than 60 years of age would be considered vulnerable. And also would include those who have chronic medical problems. Also would include those who have an immunocompromising condition, something that lowers your immune system. So if you are in those categories, we would consider you vulnerable or susceptible to a severe infection from influenza virus. So that's a high priority for us to vaccinate. But if you're not in those categories, we still recommend that everybody 6 months of age and older get a flu vaccine, because you may not be the one at risk, but somebody that you're in contact with could be, and you could do your part to protect them by making sure that you are protected yourself. How do I get it? How do I get a flu shot? Well, that's simple. You can get it from our office. We have it available today, starting about 2 to 3 weeks ago, and we should have it for the next coming weeks and months. And to do so, you just call and make a nurse visit. And it is a short visit just for one of our medical assistants to bring you back and to administer that vaccine, and then you're on your way. You can also get it at a regularly scheduled appointment at any of our office locations for any reason at all. If you come in to any of our offices, we should be able to give you a flu vaccine at that time. You also are able to get flu vaccines from pharmacies, from grocery stores, from the health department. There are many other locations that offer flu vaccines. When should I get it? I've heard that if I get it too early, then it won't last for the whole season. And part of that is true. We do know that the antibodies that your body creates from the vaccine are going to go away at some point. And so we don't want them to go away too soon, because then maybe you'd have still a few more weeks or months of the flu season that you would not be protected. Well, rest assured, the vast majority of individuals that have been looked at for their antibody levels and have had them drop off are older individuals. And we do have a high dose influenza vaccine to give those individuals so that they have more long lasting antibody protection. We do realize that some may still have a drop in their antibody response, and they may be susceptible to the infection towards the end of the flu season, but we don't know who that would be, and we don't know how far their antibody levels drop. So you're left with two choices, two options. Option one is get the flu vaccine right away before the season starts, knowing that it takes 2 weeks for your body to create the antibodies to protect yourself. And then you're protected going into the flu season, which could start at any time, so you don't know when you'll be exposed to it. And then you'll have that last to some point towards the end of the flu season, and you would be theoretically, possibly, potentially at risk at the end of the season to not have the protection to fight against this virus if you get exposed to it. The second option is hold off, wait, don't get your flu shot until you know it's the start of the season, potentially exposing yourself to the virus when you don't know when it's starting, you don't know who has it, and you may encounter it before you have any protection at all. Get your flu shot later and then hope that it lasts for the whole season. We would prefer that everyone get their flu shot early. We prefer that it's early so that you have the 2 weeks to build your protection before the flu season starts. If we have everybody on the same page with that, then we typically have a much better flu season. So I recommend getting it early. The CDC says as soon as it's available, or at least before the end of October. So we recommend one of those options. Why do I have to have it every year? Why get a flu shot every year? If I had it last year, shouldn't that protect me this year? Well, just like I mentioned before, your antibody levels will drop off to some degree, and we don't know how far. Plus, as I mentioned before, this virus mutates and it changes. And so our vaccine is updated every year to match what we expect to be the strains in the community each season. So even though you had a flu shot last year, it's still important to get one this year to boost your antibody response and to make sure that you have the right strains in your body to protect you against what we think will be in the community. What side effects are there? Well, most commonly, no side effects. The most common reported problem with the influenza vaccine is nothing. I feel no problem. I feel no different. But when somebody does have a side effect, what are the most common side effects that are reported? Most commonly, someone will have a little bit of malaise. That means they're a little tired, a little run down, maybe feel a little feverish, a little chilled, maybe a little muscle aches or pains. Those are usually mild. Those symptoms typically go away after 1 or 2 days. And when you do have those symptoms, you can feel confident and reassured that your body, your immune system is responding the way it should. And that gives you great confidence that you should have those good high antibody levels to protect you, and the vaccine will work effectively. Other side effects that people report less commonly would be nausea, vomiting, diarrhea, sometimes headaches, a local site reaction. Some have reported where they get the flu shot, they have redness develop in a small patch. It's a little warm to the touch and a little tender. That usually goes away in about a week, and you can treat that with some Tylenol, anti-inflammatories, or an ice pack. There are a few rare side effects that do happen with influenza vaccine that have been reported, and we caution you about. One would be a severe allergic reaction. If you are allergic to some component of the vaccine, there is the potential of developing a severe allergic reaction. Also, there's a condition called Guillain-Barré syndrome. This is a very, very rare, uncommon neurologic disease that involves weakness developing in your extremities. It's rare to see it, but it is associated with influenza vaccine, so it's something to be aware of. Other reactions would be arm soreness, shoulder pain, and again, these are usually very mild and go away. What about egg allergy? I've heard that the influenza vaccine is grown in chicken eggs and I'm allergic to eggs, and so I shouldn't have the influenza vaccine. Well, as it turns out, it's true that the vaccine is developed using chicken eggs, and there are small proteins that become a component of this vaccine, egg proteins. And there is a potential that if you have a severe allergy to eggs, that you could have a reaction to the vaccine. However, based on all of the reports and investigation on these types of events, it is believed that everyone, including those with severe egg allergies, are able to have a flu vaccine, except it is important that they have a flu vaccine in a medical facility where they could be monitored and they could be treated if an allergy does develop. Well, what if I'm sick? If I'm in the office, I'm sick, can I still get a flu vaccine? The answer is yes. If you have a mild infection, even with a fever, it is okay to still have a flu vaccine. Your body will still respond appropriately, and the flu vaccine, we do not believe, will make anything worse. If, however, you have a moderate to severe infection, it's best to delay your vaccination until some point after you recover. The reason is because we don't want any confusion about whether your symptoms are due to the illness or they're due to the vaccine. And so we want you to wait until you feel better. Well, what good does it do? Why get a flu vaccine if it's not going to match the viruses in the community? If it won't help protect me, why should I do it anyway? And there's a lot of good thought behind that question. Year to year, it varies how effective the vaccine is at preventing influenza infection. Some years it's as low as 20%. Some years it's as high as 70%. Year to year it varies, and that goes according to what virus strains we see in the community and whether there's a match or not. However, we do believe that it is effective at preventing some infections, meaning if you get your flu shot, you are less likely to have an influenza infection. But we also know with certainty, with great confidence, year after year, whether it was effective or not at preventing infection, the flu vaccine does reduce your risk for a severe infection. So even if you do get influenza infection, the virus, and you had your flu shot, it's going to be a less severe illness than if you didn't have your flu shot. Hospitalizations, ICU admissions, death rate, all are much, much higher in the population of people who get influenza virus and have not had their flu shot. So for that reason, knowing that we can protect some from getting it, and we can protect a lot from having severe illness, we recommend you get your flu shot. Well, what about me? What am I going to do? What about me and my family? Again, we recognize that vaccines in general, and particularly the influenza vaccine, is a very complicated issue with lots of pros and cons and lots of different perspectives and takes on what to do about it. That being said, we hope that everybody would make an informed decision about what's best for them, their family, and others around them. For me and my family, I'm going to get my flu shot. My kids have already had their flu shots. My wife has had her flu shot. We are doing our part to hopefully protect others, to protect ourselves, and in the event that we do get the infection, we would expect a much less severe illness than if we don't get our flu shots. So Thank you for listening today for this information. If you have any questions or you'd like to discuss it further, I would recommend that you call our office or send a message to your provider, and we'd be happy to talk with you further about any specifics related to your personal conditions and your questions about influenza vaccine. Thank you.